multitasking, but those of you who know me know that that is a common thing. So good morning. Thank you for joining us today. We're going to be talking about the EPA's draft risk evaluation. For those of you who I haven't met, I'm Linda Reinstein. I'm the co-founder of the Asbestos Disease Awareness Organization, and I'm also a mesothelioma widow. In keeping with ADAO's tradition, we're dedicating this press conference to Mike Mattmuller, who died from preventable mesothelioma just after his 38th birthday in April. Mike leaves behind a young wife and a baby. Today, you're going to be hearing from leading experts and stakeholders who have carefully reviewed the draft risk evaluation and will be highlighting their concerns. But let me take you back just a wee bit so you understand the basis of our work. Since 2004, ADAO, an independent nonprofit organization, has been dedicated to preventing asbestos exposure to eliminate all asbestos-caused diseases. Each day, asbestos exposure continues in homes, schools, workplaces, and in the environment throughout our nation. Yet, asbestos remains legal and lethal in our country today. The facts are irrefutable. Each year, nearly 40,000 Americans die from preventable asbestos-related diseases. Also, 70 countries have banned asbestos, yet the United States is leading the race to the bottom in its inability to act. Our government has failed time and time again to ban this carcinogen, and shockingly, since the EPA tried to ban asbestos in '89, the U.S. has consumed nearly 400,000 metric tons of asbestos, and we have buried over 1 million Americans. As Congress considers improving our chemical laws, asbestos was the poster child when we were discussing TSCA reform, the TSCA Substances Control Act reform that was originally passed in 1976. And many on this call today, we actually breathed a sigh of relief. We were so excited when the Lautenberg Chemical Safety Act was signed into law nearly 4 years ago. It was supposed to be the law that could finally ban asbestos. Well, let's take a look here. Since then, the EPA's actions have been disappointing at best. Implementation of the new TSCA for asbestos has been a frustrating struggle for all of us. We aren't alone thinking about this. EPA's own scientists and civil service have expressed their deep concerns with the agency's approach last year, and it was reported in the New York Times. Today, you're going to hear about the unfortunate omissions and flaws in the EPA's draft risk evaluation from a variety of experts and advocates. In brief, the risk evaluation excludes asbestos legacy despite the ruling of the Ninth Circuit Court of Appeals last year, saying that the EPA was obligated to evaluate the risk. It also excludes the other 5 fiber. It's only going to evaluate the risk of chrysotile. It's only going to evaluate 2 of the many diseases that asbestos causes. It will only evaluate lung cancer and mesothelioma. However, those with ovarian cancer caused from asbestos, laryngeal, asbestosis, those risks will go undocumented. It's ignoring the contamination of talc-based products, even though ADAO and many others have been doing product testing and discussing this with the EPA. It can be found in kids' toys and crayons. And lastly, it's actually excluding the libby-amphibole from the risk evaluation, which could be found in about 15 to 30 million homes across the United States. Because of these and other flaws, we're deeply skeptical that the EPA will put in place a full ban under TSCA and act with urgencies. Americans need and deserve legislation to finish the job the EPA started in 1989 to ban asbestos. Now, you're going to hear from many speakers today. You don't have to take copious notes. We are going to link to their comments as they are available. And ADAO and other speakers have submitted comments already into the docket, which will make sure that the journals have copies of. So if you'd like a copy of these, just let me know personally. Also, we'll be using the chat to the far right side, so you can ask questions, and Nicole and Tracy will log those. But most importantly, thank you again for being here, for understanding that this draft risk evaluation for asbestos will once again leave Americans dangerously unprotected from asbestos. I want to turn the next presentation over to Bob Sussman.
Yeah, good afternoon, everybody. This is Bob Sussman. I am ADAO's legal counsel and was a senior EPA official in the Clinton and Obama administrations. Asbestos is not any chemical, but a uniquely hazardous substance that has taken the lives of over 1 million Americans. There is a compelling need to inform the public about this enormous threat to public health, but the draft EPA evaluation ignores critical aspects of asbestos exposure, disregards known health effects, and greatly understates risks. This is the first comprehensive evaluation of asbestos in 35 years. Unfortunately, EPA's approach is a giant step backward from the high quality science in previous assessments. It basically walks away from the long-standing risk assessment framework that government scientists work hard to develop and that has guided asbestos prevention policy for 3 decades. In 2008, an effort to alter this framework was rejected by the EPA Science Advisory Board. Now, however, this discredited approach is resurfacing in EPA's calculation of the all-important inhalation unit risk for asbestos. I won't get into the details, but the bottom line is that the EPA IUR results in a considerably lower cancer risk than EPA's 1988 IRIS assessment. At a time when we should be eliminating asbestos exposure, this is not where we want to be. EPA is also shockingly uninformed about the specifics of asbestos use and exposure. The draft evaluation repeatedly admits that EPA has virtually no information on the asbestos-containing products that we import, including the quantities, the number of end users, and the sites where asbestos exposure occurs. ADAO in 18 states petitioned EPA to use its authority under TSCA to require industry to report this information, but EPA refused. Now we are seeing the consequences of this self-created information void. Finally, while some may say that the remaining active uses of asbestos are insignificant, the risk evaluation paints a different picture, indicating that nearly 1 million workers are exposed to asbestos from these uses, and up to 32 million do-it-yourself consumers replace asbestos brake pads and clutches. This is without considering the many millions of Americans exposed to legacy asbestos, which is excluded from the evaluation. Because of the evaluation's many flaws, it is hard to have confidence that this EPA will take aggressive action under TSCA to eliminate asbestos exposure. The only viable path forward is action by Congress. That's why ADAO is working hard to support enactment of the Alan Reinstein Ban Asbestos Now Act. Congress must pass this vital legislation without delay. Thank you. And I'm turning it over now to Celeste Monforton. Celeste?
Thank you, Bob. Good afternoon, everyone. I am Celeste Monforton, and I'm a lecturer in public health at Texas State University, and I'm a member of the American Public Health Association. APHA has 150 years of experience speaking for policies backed by science, and our mission is to improve health and achieve health equity. We are approaching the 4-year anniversary of the Wattenberg Chemical Safety Act, a legislative accomplishment where asbestos was used to illustrate the profound need for a stronger law, yet we are no closer to banning asbestos than we were when that law was passed. Since that time, APHA has submitted comments and met with EPA at every opportunity to explain the grave risk of exposure to asbestos, particularly to workers and to communities of color that already experience health inequities because of income, race, and ethnicity. In May 2019, APHA testified before Congress to express our deep concern that EPA's decisions to date would fail to address the threat asbestos poses to public health. The agency's draft risk evaluation is incomplete and its assumptions inappropriate. It fails to address, for example, the risk created by the millions of metric tons of asbestos already in use. This means ignoring risk to communities where families live in substandard housing and children go to school where cities have disinvested in public buildings. This risk is increasing because of extreme weather events brought on by climate change. EPA indicates it reviewed air concentration data from OSHA inspections. EPA does not mention, however, the 22 states and territories that operate their own OSHA programs. Most of these agencies have their own analytical laboratories and maintain their own data of sampling results. When assessing this data, EPA should assume that samples collected by inspectors are the best case scenario. The safest day for workers is when an inspector is present. It's all the other days that we need to worry about. EPA must also take into account the family members who are exposed secondarily to asbestos through occupational take-home exposures. EPA should examine violation data from OSHA, not merely air sampling data. Violations provide evidence of workers' potential exposure to asbestos, and citations are not contingent on violation of the PEL. This is critically important because the OSHA limit is not health-based. The PEL is what was deemed feasible 25 years ago when the standard was adopted. OSHA acknowledged that 6 workers for every 1,000 faced an excess risk of lung cancer, even if employers fully complied with the asbestos standard. EPA must also be much more judicious when it relies on information provided by organizations with conflicts of interest in the outcome of the risk evaluation. EPA must assess the reliability of this information, and the benefit of the doubt must bend toward public health. More than a decade ago, APHA called for a complete ban on asbestos. I'll say that again. More than a decade ago, APHA called for a complete ban on asbestos. We remain steadfast in that position and why we strongly support the ban asbestos bill that is being considered by Congress. I'm now going to pass the microphone to Pat Morrison.
Thank you, Celeste. I appreciate that. Good afternoon, everybody. My name is Patrick Morrison. I am Assistant to the General President for the Department of Health and Safety and Medicine at the International Association of Firefighters. I'm here today to speak about how EPA excluded legacy asbestos from the Toxic Substance Control Act chemical evaluation process. And I'd like to talk to you about a study, the 2013 National Institute for Occupational Safety and Health, NIOSH, study that identifies firefighters as a greater risk of developing mesothelioma caused by asbestos exposure on the job. Occupational-related cancers now account for over 65% of firefighters' line-of-duty deaths each year, as reported to the IFF. This is the largest health-related issue facing the firefighting profession. Contributing to our high rates of occupational-related cancers are exposures to toxic chemicals, including asbestos. Firefighters face a high risk of this exposure because asbestos becomes airborne when disturbed or damaged by fire. Despite these known exposures, EPA has excluded the legacy asbestos from the chemical risk evaluation. Our members enter burning buildings, extinguishing fires, and then we open walls, we pull ceilings down, we check for that fire extension. These tasks expose firefighters to the asbestos fibers. Oftentimes, members are completely unaware that a building contains asbestos. These activities are daily occurrences happening right now in the communities where you live. And while the asbestos is legacy, these are technically new uses and new exposures for our members. After the initial exposure, asbestos fibers can remain on our turnout gear and at the station and clothing that spreads not only to the apparatus cabs that we have in our firehouses, but even back to our houses where we live, taking it back to our families. Firefighters can inhale large amounts of these microscopic fibers and unknowingly increase their risk of developing an asbestos-related disease, such as mesothelioma, lung cancer, and asbestosis. According to TSCA, the term susceptible subpopulation means a group of individuals with the general population who may be at greater risk than the general population of adverse health risks from exposure to a chemical substance or mixture, such as children, pregnant women, elderly, and workers, which would include us, firefighters. Based on the fact that firefighters frequently enter buildings filled with asbestos and performing fire suppression activities, typically without knowing this exposure is present, the firefighting occupation definitely falls under the category of susceptible subpopulation. The 2013 NIOSH cancer study, it was a monumental study for the fire service, also identified firefighters as a susceptible subpopulation. This was a cohort study. We evaluated over 30,000 firefighters over a 60-year timeframe. The multi-year study was the first study to identify the firefighters in that study had a rate of mesothelioma 2 times greater than the rate in the US population as a whole. Also, the findings show that the malignant mesothelioma is largely attributed to asbestos exposure with sparse evidence of any other causes. In closing, we believe that EPA should evaluate firefighters as a susceptible subpopulation and evaluate legacy exposure to the chemical risk evaluation process. Thank you very much for letting me speak to you here today. I would like to turn it back over to Linda.
Thank you, Pat. That was excellent. Before I start, I'd like to take a minute and recognize Pat, you and IAFF and APHA and the doctors that we have on this call. You've done so much to give of yourselves during COVID-19. We are safer and better because of you. And I wanted to personally send our thanks to all of you. Dr. Lemon is disappointed that he can't join us in person today, but he prepared detailed remarks that I will read. They're very scientific because he is a distinguished epidemiologist, and you would expect that from Richard. So these will be available online. I'm going to read Dr. Lemon's prepared remarks now. The draft risk evaluation by EPA suggests that you would draw the radical conclusion, contrary to decades of established science, that there are safe levels of asbestos, of exposure to asbestos, and therefore use of asbestos in the United States should be condoned. The danger in relying on only select epidemiology studies is revealed by the growth in our historical understanding of asbestos hazards. In the early 1970s, studies estimated exposures to asbestos to below 200 to 300 fibers per cc. Years were not associated with increased cancer deaths. By 1980, studies were found no increased risk of lung cancer deaths below 20 fibers per cc years at a level 10 times lower. By 1998, another study found exposures of 0.5 to 0.099 fibers per cc produced a 4-fold increase of cancer. And in the early 2000s, yet another study found roughly an 8-fold increase of risk at exposures above 0.15 fibers per cc. These historical lessons repeatedly show how we are incapable of identifying a threshold level of asbestos exposure. The draft excludes legacy asbestos exposure, which makes up by far the greatest potential for exposures to asbestos in the U.S. today. Additionally, limiting its assessment to just lung cancer and mesothelioma when there are other recognized cancers and non-malignant disorders still occur in the U.S. today is a flaw. In limiting the draft risk evaluation to do a chrysotile-specific risk analysis is not realistic, since doing so, it screened out all of the studies in which exposures were not only to chrysotile, ending up with only 2 studies to calculate the inhalation unit of risk, IUR. This makes no sense. Unnecessarily limiting studies used for the IUR increases uncertainties when expressing their relevance to other exposure and situations, because all of the asbestos studies have limitations, such as how exposure was measured, the disease was tracked, not to mention the smaller database greater likelihood that particulates of individual studies will drive risk calculations. The draft risk evaluation abandons the customary linear approach to dose response analysis and applies an exponential model that agencies have never used before and has disfavored by the consensus of groups of asbestos scientists. The draft risk evaluation approach calculates a risk which is considerably lower than the IUR used by EPA in its previous 1988 peer-reviewed IRIS assessment by other agencies like OSHA using similar framework. It is in itself a concern. The draft risk evaluation suffers from the same underlying error that many now debunked risk assessments have suffered in comparing one set of exposure studies with entirely separate epidemiological studies. The universal consensus remains that there has not been shown a level of exposure below which has increased risk of cancer has been identified. In the United States, recent estimates indicate that there are still near 40,000 deaths occurring each year from exposure to asbestos, much of it in result of legacy. Those are Dr. Lemon's prepared remarks. It's now an honor to introduce you to Dr. Molina.
Thank you, Linda. My name is Dr. Jacqueline Molina, and I'm a board-certified occupational and environmental medicine specialist. I'm currently the chairperson of the Department of Occupational Medicine, Epidemiology, and Prevention at the Zucker School of Medicine at Hofstra University Northwell Health. Throughout my career, I've dedicated myself to studying prevention and treatment of exposure-related diseases. I recently had the honor of testifying in Congress regarding the adverse health effects of asbestos-containing cosmetic talc, and I recently published a paper on this topic. I'm concerned that the draft EPA risk assessment has serious omissions. Today, I want to focus my comments on one significant source of asbestos exposure that the draft fails to address: the presence of asbestos contamination in talc used in industrial and consumer products. There's extensive test data documenting the presence of asbestos in different grades of talc. Now, while the FDA regulates cosmetic talcum powder, other talc-based products in industrial operations fall within the purview of TSCA, which is the basis for this draft EPA risk evaluation. This omission of talc also highlights two other serious gaps in the evaluation. The scientific evidence is clear asbestos causes ovarian cancer, including from asbestos that may be found in talc. Yet the EPA only included lung cancer and mesothelioma in their risk evaluation. In addition, the asbestos found in talc is a mixture of fiber types, but the EPA only examines the risk from chrysotile in the mistaken belief that this is the only fiber. If asbestos in talc is added to the draft evaluation, EPA will need to address both these limitations so that talc-related risks can be fully assessed. Talc is the softest mineral known to man. That property offers advantages in a wide range of consumer and industrial products. In the US, talc is found all over, from eastern Appalachia and Piedmont regions from New England to Alabama. Important deposits are also found in California, Montana, Nevada, Texas, and Washington. Now, not every talc deposit contains asbestos. However, geologists have documented that talc deposits included or are located near asbestos deposits. These asbestos-containing deposits contain tremolite, actinolite, or anthophyllite, all forms of amphibole asbestos, as well as chrysotile. For example, talc from Death Valley, California has tremolite and actinolite asbestos. Health officials long ago noted that New York State industrial talc miners were dying from lung cancer, lung scarring, and pleural cancer. Their lung pathology looked just like asbestosis. There have been several published reports of cases of mesothelioma among these New York industrial talc miners. Now, talc-based consumer products, not just consumer talcum powder, contain asbestos. Several groups found an amphibole asbestos present in crayons due to the addition of talc into the crayon mixture. This is a particular concern since children are the primary users of crayons. Now, industrial talc use is widespread. In the United States, in 2018, 894,000 metric tons of industrial talc was used from domestic and imported sources. Where is it used? The top four areas are plastics manufacturing, ceramics, paint, and paper. It's also used in fertilizer, insecticides, it's on seeds, it's even in gloves that we use to assist in donning. It's used in plastics as a filler. Ceramic products such as bathroom fixtures, ceramic tile, pottery, and dinnerware often have talc. It's used to improve the firing characteristics of the ceramics and to improve the strength of the finished product. Mixing the talc ceramic mix poses risk for potters, manufacturers, and hobbyists who work with these ceramic products. Talc is used in paints as an extender and filler. It's used to improve the opacity, brightness, and whiteness of paper, and it helps for the ink to adhere. These industrial uses likely expose thousands of workers and consumers to talc product by inhalation and dermal contact. The extent to which this talc contains asbestos is not known, but based on my investigation of the link between talc-based talcum powder and mesothelioma and ovarian cancer in women, I'm concerned that industrial talc exposure is a cause of asbestos-related death and disease. In conclusion, the omission of talc-based consumer and industrial applications from the draft evaluation is a significant gap because of the likelihood that some grades of talc used in these applications are contaminated with asbestos, putting consumers and workers at risk. EPA should include these conditions in its risk evaluation. To assure that their risks are fully assessed, it should also expand to include the other known health impacts, such as ovarian cancer, and address all fiber types, not simply chrysotile. Thank you for your time, and I'd like to turn it over to Brent.
Thank you, Dr. Molina. Hello, my name is Brent Kynock. I am the Managing Director of the Environmental Information Association, or EIA. EIA is a membership organization that was started in 1983 as the National Asbestos Council. EIA members are companies, organizations, and persons involved in asbestos abatement and management of asbestos in buildings and facilities. Our members include the entire vertical spectrum of persons involved in the abatement industry, including contractors, consultants, laboratories, training providers, regulators, equipment suppliers, owners, and managers. I have been actively involved in EPA's process of a risk evaluation for asbestos since it was first declared as a chemical under review in December 2016. I've submitted comments to the docket at every possible opportunity, and I've been involved with ADAO and others in numerous meetings with the EPA officials that have been involved in the review of asbestos under TSCA. So I'm intimately familiar with the issue, and I've been involved with the process since day one. To begin, let me say, I am delighted that EPA has found that most conditions of use of asbestos have been deemed to present an unreasonable risk. This is truly wonderful news. It's a victory for those that have been seeking a ban on asbestos. But you may not realize that EPA did everything possible in the development of the risk evaluation to underestimate and downplay the risk of exposure. Yet, the numbers don't lie. Asbestos is a killer, and EPA had no choice but to conclude that it presents an unreasonable risk. In spite of the fact that EPA has concluded asbestos presents an unreasonable risk, I still have several concerns about EPA's risk evaluation, and I'd like to bring them forward for consideration. First, as you've heard from others, I have a concern that the requirements imposed by the Ninth Circuit Court of Appeals in the Safer Chemicals Healthy Families matter has not been addressed by EPA. This is the decision that involves the so-called legacy asbestos that is currently in homes and buildings, but is not in the stream of commerce. It is my opinion that EPA's plan to submit a supplement to the risk evaluation for legacy asbestos will not adequately address the exposures associated with asbestos that is in tens of thousands of homes and buildings throughout the United States. By not considering legacy exposures as an integral part of the current risk evaluation, it has narrowed the modeling and has undercounted both exposure and mortality rates. A supplemental document and risk evaluation will do nothing if it is not integrated into the entire risk modeling exercise. Second, and related to the issue surrounding legacy uses and exposures, is EPA's decision to use only chrysotile in its risk evaluation. You've heard this from others. It's my belief, and it has been documented in many studies, that exposure to other forms of asbestos may in fact result in higher mortality rates than exposure only to chrysotile. Third is EPA's decision to make a risk evaluation based only on mortality rates and not to include incidences of cancer or other non-cancer diseases that will not result in death. This severely underestimates the risk associated with asbestos exposure. EPA has provided its reasoning for not including the incidences of cancer in its risk evaluation, but I believe that this should be reconsidered. Lastly, and most importantly, is what will EPA do now? This draft risk evaluation has determined that many of the uses of asbestos present an unreasonable risk. I do not believe that the SNR enacted by EPA adequately protects persons from exposure to asbestos and ultimately to the risk of death from that exposure. EPA has the authority to ban asbestos under TSCA. EPA has determined that most uses of asbestos present an unreasonable risk. EPA should move to finally ban asbestos in the United States. Now I'd like to turn it over to Liz Hitchcock.
Thank you, Brent. Good afternoon, and thank you for joining us today. My name is Liz Hitchcock, and I direct Safer Chemicals, Healthy Families. Throughout the legislative campaign to reform TSCA, we led a coalition of health, consumer, environment, and business organizations to make the case for a reformed law that protects public health from hazardous chemicals in our homes and workplaces. I'm proud to say that one of our most effective and tenacious coalition partners was the Asbestos Disease Awareness Organization, led by Linda Reinstein. Let me start with a little review. Hundreds of groups joined us in our campaign for a more health protective chemical policy because TSCA was universally recognized as broken and ineffective. TSCA is a tough law to explain to the general public, and explaining what was wrong with it got really complicated really fast. One of the best ways for the public to get our heads around the problem we faced with TSCA was the story of how EPA tried and couldn't even ban asbestos under the law. The public understands that asbestos is dangerous, with thousands of Americans dying from illnesses connected to asbestos exposure every year. We all know someone who has lost someone they love. The failure to protect us from asbestos became a symbol of TSCA's failure to protect us from other toxic chemicals. So when the Lautenberg Act was finally passed, it gave EPA the tools they needed to do the job of protecting us from one of the most dangerous substances we know. But here's the thing. The story of old TSCA was that EPA could not protect our families from asbestos. The story of new TSCA under the Trump administration, I fear, is that EPA will not protect us from this deadly chemical. Unfortunately, it seems that EPA is leaving the shiny new and improved tools that they got in Reform TSCA out to rust in the rain. For decades, asbestos has been everywhere, in our homes, our schools, public buildings, offices, stores, and factories all across America. And asbestos remains in the built environment where it continues to pose a threat to public health to this day. Up until just a few minutes ago, I was listening to a jackhammer outside my house because they're renovating the apartment building across the street. That's not so unusual in DC. But today, it's been a loud reminder that as buildings are torn down or gutted to make way for new construction, asbestos waste is generated and disposed of in the US in significant quantities. That asbestos waste in commerce at landfills and construction sites puts workers and the public in significant danger. And they're not the only ones who are exposed. As you heard from my colleague, Pat Morrison, firefighters face greater risks of asbestos exposure and the related diseases. School teachers, especially in elementary and middle schools, are at higher risk of mesothelioma than the general population because of the widespread presence of asbestos in schools that were built in the 60s and 70s. The asbestos risk evaluation is an important tool to update our understanding of the prevalence of legacy asbestos and its risk. Without this important information, how can we protect those of us at risk of exposure? Safer Chemicals, Healthy Families was so concerned by early indications that EPA wouldn't meet its obligations under TSCA that we filed our first ever lawsuit to compel EPA to address the use and disposal of legacy asbestos in its risk evaluation. The good news is that the court agreed with us and with our colleagues. The bad news is that EPA's draft risk evaluation fails to address the risks of legacy asbestos. The American public expected and deserved better from so-called new TSCA. EPA should set the stage for a comprehensive asbestos ban by including all uses in its risk evaluation, including legacy uses where we live and work across the US. And now I'll turn it over to Dr. Arthur Frank. Dr. Frank?
Thank you very much, Liz. By way of introduction, I too am an occupational physician, trained at Mount Sinai with Dr. Irving Selikoff, and started my 50-plus year research career there. I obtained a PhD there as well, studying the effects of asbestos, and spent time at the National Cancer Institute looking at the effects of asbestos on respiratory tissue. I've devoted my whole career to looking at asbestos-related issues. I take great pride in being co-chair of the ADAO Scientific Advisory Board, along with Dick Lemon, and several of the speakers today are also members of the Collegium Ramazzini, which have banded on numerous occasions. The organization has to call for the banning of asbestos. You've heard much of the commentary already, and I just want to repeat a few points because every one of these has been areas that I have worked in, both here in the United States and North America, but in Asia, South America, and elsewhere. We need to consider other cancers, not only ovarian and laryngeal cancers, but there's good evidence for gastrointestinal tract cancers, kidney cancers, and others that should be looked at. We need to look at the 5 amphiboles, not just chrysotile. As you've heard, we need to look at talc and the asbestos contamination of vermiculite that is in millions of homes here in the United States. We need to consider more so than what was considered textiles, because we still use asbestos gloves and aprons, and textiles are found inside turbines and other equipment. And we need to look at cement pipe more than is being looked at due to ingestion and workers who are exposed to the cement pipe. Lastly, we need to truly consider the legacy of asbestos because it is still with us. There are millions and millions of tons in place in the United States, and huge amounts of asbestos are still used in things like brakes. Contaminated talc is still used to make automobile tires and other rubber products. And at the end of the day, the EPA draft doesn't go far enough. At this point, I would like to turn it over to Dr. Penny Fenner-Crisp. Thank you.
Penny, are you there? I see her online, but
Yep, I didn't unmute. Sorry about that. I'll start over real quick. Good afternoon. My name's Penny Fenner-Crisp. Today I will be presenting comments on behalf of the Environmental Protection Network, EPN, an organization comprised of more than 500 EPA alumni who volunteer their time to protect the integrity of EPA, human health, and the environment. During my 22-year career at EPA, I served as a senior toxicologist in the drinking water program and as a senior executive and science advisor in the pesticide and toxic substances program. I will highlight just 3 areas of EPN's concern about the asbestos draft risk evaluation. They've been mentioned earlier as well. For more extensive discussion of our assessment, I'd refer you to the written comments that have been submitted to the EPA docket. Much of EPN's concern about this draft risk evaluation centers around its scope and exclusion. How much is missing that is necessary for it to be a robust, meaningful, and useful exposition of the impacts that exposure to asbestos in any form has on human health and the environment? The first point that's been mentioned, EPA must now assess legacy uses. They've stated that they plan to address the other forms in the supplemental document. We've recommended that this assessment proceed with all deliberate speed and then include evaluation of all fiber types, including the chrysotile. Much of the available literature on asbestos does not or cannot distinguish between fiber types, so attempting to parse toxicity profiles among them is not a useful exercise. The second point's already been mentioned, that narrowness of the cancer risk assessment that includes only lung cancer and mesotheliomas. The National Academies and IARC have both concluded that laryngeal cancer is causally related to exposure. IARC has concluded the same for ovarian cancer. So we've recommended that EPA's cancer risk assessment be expanded to include an analysis of the data on these two tumor sites, with an emphasis on their adequacy to support dose response assessment and the potential for inclusion in the calculation of the combined IUR. The third point, EPA did not conduct an analysis of non-cancer adverse health effects associated with exposure to asbestos. Their justification is based upon their comparison of the 2014 IRIS non-cancer reference concentration, or RFC, for Libby amphibole asbestos with the 1988 generic asbestos cancer value for cancer risks. In this case, the cancer toxicity value is clearly the driver. But this conclusion is only relevant to the general population, to which a 1 in a million standard applies. It may not be applicable to the worker standard of 1 in 10,000, a 100-fold less protective difference. Furthermore, an RFC for chrysotile may not be equal to or greater than that for Lymphy amphibole. It could be lower. Also, the agency's proposed unit risk for chrysotile that's about a third lower, that is less conservative, when compared with the 1988 value. But that IUR may change if the data on laryngeal and or ovarian cancer are integrated into it. The interplay of these factors is unknown, but it could result in the flipping of the risk driver from cancer to a non-cancer effect, or more likely, lead to a significant underestimation of the overall health risks of asbestos exposure based on cancer alone. We won't know until and unless an analysis of the non-cancer effects is conducted. So the bottom line, even with a narrowed and exclusionary scope, EPA has concluded that most of the conditions of use examined pose an unreasonable risk. That makes the regulatory options narrow and relatively simple in our view. Just 2 steps: vacate the SNUR and issue a comprehensive ban on all forms of asbestos. 30 years is more than enough time to develop alternatives to the uses that were not previously phased out. Thank you for your attention, and we'll turn the mic over to Dr. Castleman.
Hello. My name is Barry Castleman. I've worked with environmental groups, governmental organizations, and international organizations on asbestos over the past 40 years. I also testify about the public health and corporate history of asbestos as an expert in personal injury trials, usually at the request of plaintiffs, and I've published on asbestos in the scientific literature. EPA draft underestimates asbestos exposures from asbestos product use. In particular, it assumes that the 750,000 mechanics in this country, none of them use compressed air hoses to clean brake assemblies. The most recent information we have indicates the opposite. And the EPA draft neglects the Longo study from 2002 showing that wire brushing of asbestos containing gaskets from pipe flanges creates exposures of over 30 fibers per cc, extremely high levels of exposure. That study was not included in the EPA draft. The EPA draft ignores legacy exposures, which can be quite high. Asbestos flooring felt consumed 130,000 tons a year of asbestos in the 1970s. And the sanding technique that was widely used and may well still be widely used to remove patches of cemented asbestos felt adhering to floors creates exposures of 37 to 56 fibers per cc during sanding, extremely high levels of exposure. Hundreds of thousands of miles of asbestos cement pipe supply drinking water and carry wastewater in this country, creating a hazard to thousands of utility workers and the public. Nothing about this is being said in the EPA draft. With respect to U.S. asbestos product imports, these are not being investigated fully by the EPA. The EPA didn't track down the U.S. importer of asbestos yarn and thread, who imported 85 metric tons of asbestos yarn and thread from Mexico last year and has been doing so for the past decade. Our concern has been repeatedly expressed to EPA. EPA didn't go to the importers of record of the asbestos cement and asbestos building materials also recorded in U.S. government statistics. They could have gone to the US Customs Service and identified the importers and gone to the importers, find out how they're using that stuff. Same thing with asbestos gaskets. They only went to one importer and one customer. The other importers weren't contacted for reasons the EPA doesn't express. The EPA assessment of asbestos hazards at diaphragm cell chlor-alkali plants was based on selected information supplied by the Chemical Industry Trade Association. The EPA should have summoned all of the data. These companies, these 15 companies, have been presumably complying with the OSHA regulations since 1972, requiring regular monitoring of the exposures, and all the exposure data should have been summoned by the EPA. Instead, they did 2 plant visits and accepted the information selected by the Industry Trade Association. Chemical Press also reported the EPA issued heavy fines against chlor-alkali producers for asbestos in these cell renewal areas. We've asked the EPA to produce their enforcement records, and so far EPA has not done so. As to contaminant asbestos in talc and vermiculite and taconite and crushed stone, this has already been mentioned to some extent. I just want to emphasize that the vermiculite from Libby, Montana was installed as an insulation in millions of homes and contains what the EPA calls Libby amphibole asbestos. This is a mortal danger to a great many people in this country, especially with us all cooped up in our homes. And the EPA ought to be doing something about warning people about this. And last, I just want to pay tribute to the career civil servants who are hanging in there at EPA trying to protect the environment during this administration. This too will pass. The next speaker is Dr. Christine Oliver. Thank you.
Good afternoon. I don't know if I'm on the larger screen.
Anyway, good afternoon. My name is Christine Oliver. I'm an adjunct professor at the Dalhousie School of Public Health at the University of Toronto and a consultant in occupational and environmental medicine in Boston, where I was an associate professor.
Your audio just went wonky. Could you please start again? Yours is so important. Just try again. We heard a little sound like your mic might have moved.
Is that better?
Yes, thank you very much.
Okay, sorry about that. My name is Christine Oliver. I'm an adjunct professor at the Dalhousie School of Public Health at the University of Toronto and a consultant in occupational and environmental medicine in Boston, where I was an associate professor at Harvard Medical School and a practicing physician in the division of critical care, pulmonary and critical care medicine at the Massachusetts General Hospital. The EPA draft risk evaluation for asbestos in its present form both underestimates and understates the true risk of asbestos. It understates the risk with its singular focus on only one of 6 asbestos fiber types regulated in the United States, namely chrysotile asbestos. The draft risk evaluation, as you've heard, ignores risks from amphibole fibers that are in widespread use in the United States in insulation and construction materials, vermiculite, and a variety of other products. The draft risk evaluation understates the risk by considering only 2 asbestos-related diseases, lung cancer and malignant mesothelioma. It does not include in its risk assessment cancers of the larynx and ovary declared to be asbestos caused by IARC. It does not include non-malignant diseases such as asbestosis and diseases of the pleura or lung lining. Further, its emphasis on mortality to the exclusion of incidents underestimates and understates the scope of the problem. The draft risk evaluation underestimates the risk in at least 2 other ways. First, the exponential statistical model chosen to define the dose-response relationship between asbestos and related disease is less protective of the public health than the model used by the EPA and other federal regulatory agencies for decades, namely the linear model. This is a validated and accepted model showing no dose of asbestos below which there is no risk for disease. In other words, there is no threshold. Secondly, the inhalation unit risk, which is the risk per exposure unit defined as fibers per centimeter cubed of air, is calculated, as you've heard, using data from only 2 epidemiologic studies, whereas unit risk was previously calculated using data from multiple scientific studies. The newly calculated IUR is considerably lower and therefore less protective than that previously calculated and used. Finally, and importantly, and again, you've heard this before, the draft risk evaluation sets legacy asbestos aside for another and uncertain date. Legacy asbestos is asbestos left over from asbestos-containing materials previously and newly used in public, private, and commercial buildings, in homes, in industrial workplaces, and in other settings, as well as in a variety of commonly used products. In failing to consider legacy asbestos in a timely way, the EPA ignores asbestos that presents the greatest risk to the greatest number of Americans. These Americans include students, teachers, and custodians in public schools, clerical workers, administrators, and maintenance personnel in private and commercial and government office buildings, healthcare workers and patients in hospitals and outpatient clinics, and workers in a variety of industrial settings. The limitations of this draft risk evaluation clearly demonstrate that the only way to protect Americans from the ravages of asbestos is to ban it. Now I'll turn the microphone back over to Linda.
That was excellent, Dr. Oliver. I'd like to invite the other 11 speakers, 10 speakers. Christine, please stay on. We're going to have all of you turn your cameras on so our attendees can see your faces and become more familiar. I know that when Mike's parents and his wife watch this video, the strong comments from each of you will resonate with them that their son's time on Capitol Hill was not lost, although he lost his life to asbestos. We have multiple questions here to maximize time. We are going to start with the journalists first, but I also want to thank some of the staffers from Senator Merkley, Chairman Pallone, Representative Bonamici's offices. These offices have worked very hard on the Alan Reinstein Ban Asbestos Now Act. And for those of you who aren't familiar with, we'd love to have your support. It actually includes the Libby Amphibole as far as a ban. It has a section in it to work on evaluating legacy asbestos. And it also requires the chemical companies using asbestos to report to EPA. So those of you may be frustrated thinking like this is Einstein's definition of insanity, doing the same thing over and over again. We actually have a resolution for a problem. So I'll ask the speakers. I think you guys are all online now. Great. First question is from Pat Rizzuto at BNA, and it's going to go to Celeste. Reading the question, the EPA says it must complete the current risk assessment so it can begin to craft regulations to protect individuals facing unreasonable risk. What would you have the agency do for those facing too much risk? Celeste?
Well, first off, I hope EPA isn't actually making that assertion, because evaluating risk and coming up with risk management alternatives are completely 2 different things, and they require different levels of expertise. And I would hope that since EPA has already made a determination that those certain applications pose a reasonable risk, that they should right now be figuring out what the mitigation strategy should be, yep, while they improve the risk assessment, that the risk evaluation that they have submitted.
Excellent. Any other speaker have a comment for Pat Rizzuto at BNA? Okay. Thank you, Celeste. Excellent. Question for Dr. Oliver. Dr. Oliver, could you please explain how using the mortality data alone, not incident data, underestimates the risk?
Well, there are 2 ways, there are a number of ways actually in which it does that. But first of all, For non-malignant asbestos-related disease, which the EPA is not considering at all, incidence exceeds mortality data. And if you only count deaths from non-malignant asbestos-related disease, you're going to miss a lot of related disease that's there. In terms of malignant disease, the EPA has tried to assess number of deaths from lung cancer and malignant mesothelioma. And the figures that they use in the document are outdated because they don't take into account the fact that treatment for lung cancer and treatment for malignant mesothelioma has improved greatly. And as it improves, survival improves, and so incidence goes up. And this is particularly true for lung cancer, where we have an effective screening tool. So focus on mortality underestimates what is increasingly and hopefully becoming the greater type of asbestos-related disease that we're going to see in our population, that is incident disease and not mortal disease.
Thank you. Excellent. Dr. Castleman, can you please share, are there safer substitutes for the chlor-alkali industry, or do they need to import asbestos to use in their manufacturing of chlorine and caustic soda?
The chlor-alkali industry can use alternative diaphragm materials that are not asbestos, that are safer materials I've been told by the Denora company that sells this worldwide that the substitute material has a payout time of about 3 or 4 years. And for some reason, that's not good enough for companies to just do it by themselves. It has a lower energy consumption. The service time of the replacement material is longer before it needs replacement. But because of its initial cost and the conversion, companies have been reluctant to do it. But it certainly has been available, and it can be used, and it does pay for itself. And it's really a situation that calls out for government regulation, because if they all had to do it, that would be the end of it. They'd just do it, and that would be that.
Excellent. Pat Morrison, in addition to the study that we're calling for in the ban bill, what do you think the government should do to prevent legacy exposure for firefighters and others after natural disasters, implosions? What would you recommend?
2 things. One is for us, there's got to be a right to know that where the asbestos is, and I think that is something that we can do. So that if it can't be removed, you know where it is, and you know that that is a hazard and that's a danger. And that not only happens to us on what I reported out on every call, but also for those that after a large-scale disaster, whether it's a hurricane, tornado, or flood, you have so many community members that live in homes that do not understand the inherent danger of what they're pulling out and needlessly exposing them to asbestos. And that is something that I think 2 of those things can be addressed by the government to get this information out to everyone.
Excellent points, Pat. I'd like to ask a question that's frequently asked of me with ADAO, and I would like to direct this to Bob Sussman, who is a former deputy administrator under Clinton's term, and has extensive experience. Bob, how long might we need to wait from the draft risk evaluation to the final, to the risk management? How much time could that possibly be?
Yeah, once EPA finishes the risk evaluation, there is a 3 to 4 year process for EPA to complete the risk management process. So if you assume that by the end of this year, EPA finalizes their risk evaluation, then a rule restricting asbestos is 3 to 4 years down the road from that. Of course, we don't know what this rule might look like. I think we all feel strongly that EPA should be banning asbestos, but We have no guarantee that EPA will want to do that. It is possible that EPA might accept requirements which fall far short of a ban. For example, it might simply tighten requirements to use respirators in the chloralkali industry or other industries. So once we get into the risk management process, nobody should assume that it's going to be smooth sailing. We're going to have a lot of challenges in front of us.
That's excellent. So we are a few minutes after 12. We've finished the hour. We hope that everyone attended really gained some insight about what a dangerous place we're in right now. And we very much hope that you will follow us, ADAO and Safer Chemicals and EIA and APHA and IAFF, all of us, to help us build a louder voice so we can truly prevent asbestos-caused diseases. We are going to be issuing a press release. You'll be able to access all of our statements and oral comments and the video. ADAO tries to embrace technology best we can from a layperson's point of view, a home office, but this video is on Facebook, and we will put a link online so you can share it with your colleagues and your listserv, and we can take education to the next level. Please join me in thanking each of the 11 speakers for doing a phenomenal job. Thank you very much. This concludes the press conference.